So thank you everyone for joining us today. And I'm just going to start, and then I keep on adding people who comes into the waiting room and join in. So we've got, today we are going to talk about COVID-19 and its impact on nursing education. What are the challenges that we face and what could be the opportunities that are presented to us? Um, I'm going to mute everyone for now, and then you will have to unmute yourself or raise your hand and I will unmute it. I'm not sure if sometimes it works. People are able to unmute themselves, sometimes they can't. Okay, so I have unmuted everybody. So Andrea, do you want to try and unmute yourself to see if you can?
There we go.
Yeah, okay. Okay, so we've got a few topics to discuss, and each presenter is going to present for a few minutes, and they will share their thoughts about what are the challenges which students have faced, what are the challenges which educators have faced, what is it that we are going to, or what's the outlook looks like as we move forward following COVID-19. Are there any things that we have learned from this crisis and that would transform nursing education? And I think the changes of which we have experienced during this period, some of them are going to be here for good. Some of them may have opened our eyes to various different issues, and we may have a different way of thinking. So the idea for today's discussion or for the today's webinar is that we are able to share our understanding and how this has happened in various parts of the world. Usually things are similar, but we may not necessarily know it all the time. So therefore, it's important to share our understanding and share how other people have been facing the issues and how they have dealt with, so that we can see how we are going forward. Okay, so we are going to start this, and for today, our first speaker is Khairunisa, who is assistant professor and assistant dean teaching learning undergraduate programs at the Aga Khan University School of Nursing and Midwifery. And Ms. Hajani provides support for the delivery of academic programs at undergraduate level at School of Nursing and Midwifery at the Aga Khan University. Khairunisa will also tell you what she's going to talk about, and over to you, Khairunisa. So during the talk, if you have got any questions, if you can keep on writing into the chat box, or if you can keep a note of it, and we will be able to take those questions later on once everyone has completed their discussion. We'll try and take questions after each talk, but we will see how we are managing time. And it may be that we take all the questions at the end, or maybe after the talk. We'll see how that goes. So over to you, Khairunisa.
Thank you very much, Parveen, for the introduction and the invite. And I'm extremely humbled and privileged to have given this opportunity to speak to everyone. So what I'm going to briefly talk about is the education from the student's perspective. Amid COVID, how the students see the issues and what the future entails, and how the educators are trying to adapt to the new situation in order to maximize the student learning and the outcomes and the experience. So the first thing that I think is common amongst a lot of students in our part of the world, especially, is the access to and the connectivity to the online education. So, given the COVID situation, the best option that all educators, be it professional, non-professional, are going online and are looking at the option of teaching online. So from the student's side, initially, the students' stress of adapting and changing the normal mode of learning that they are so used to. So in a classroom setting, having a good eye contact with the teacher, and so used to having a different strategy that entailed, physical interaction or eye contact, or physical classroom setup that they were used to, was completely stopped, and everybody started going online. So that mode did not have any transition time so that student could be prepared, or even if, for example, us who were, on the blended learning mode, the students still had the comfort that after a few online sessions, there will be some face-to-face interaction with the teacher, which has been completely lost now. So getting the student mentally and physically prepared to learn on a completely online mode is one issue that they are facing. With that, they have the stress of how they are going to ensure the learning, how are they going to assimilate the concepts that have been learned, and how are they going to adapt themselves to answer their questions online as well. It's not about just opening an article or reading or looking at a voice over PowerPoint slide, but how do they ask questions? How will they how will they be assessed on it? Will they have the resources available to be able to connect to the teacher in the best possible manner? So that's one that the struggle that the student is going through. The other is in especially our part of the world where students live in areas, around 40% of our students live in areas who do not have internet access. So the internet is of a quality where they can just post a few messages. There is no picture exchange, there is no video call, there is no synchronous activity possible. For some of them, we have even downloaded the reading material on the USBs, and we have sent people to their villages to hand over the USB that they plug into their own laptops and are able to see it and read it. So whatever they make out of whatever they are getting is all that there is. So it's also important to look at how these students will be able to understand what is being taught, how will they make sense of it, and then how will they be assessed to it. See, we are talking about healthcare system here, so the safety of the knowledge is of prime importance. We will be looking at graduating nurses who have to be safe, who have to be competent, and at the most, we are only able to give the knowledge piece of whatever we expect of them as healthcare professionals through the online modality. So, what I feel that the students will also feel and are verbalizing that they feel that there is a break in what they are going to learn on the bedside versus what they are learning online. So, the integration of the clinical aspect of the teaching, which becomes the core of nursing profession, which becomes the core of a healthcare professional, is going to be not in the best possible manner. So right now, when our country and our city is not allowing them to travel back to the hospital for hands-on, we have maximized our resources towards them to be able to do the knowledge piece. When they come back, we will have to plan the clinical and the hands-on in a manner whereby the student can go back to all those concepts that were shared online, and they are shown the integration of that knowledge with the clinical to be able to give them the comfort, to be able to give them the confidence of being able to perform and care for a patient with the required scientific knowledge that is essential for them to learn. So all that seen from the student perspective, I'm sure it's very stressful for them. They have a lot of questions that they need to be that need to be answered in terms of how the learning will take place, how the application of the knowledge will take place. And apart from the knowledge piece, as they look at the faculty members as mentors, as advisors, so losing that connection altogether with your educator and then transferring all those modalities into an online system where you are shared by a screen and you see each other and connect by a screen. Sometimes it is not possible, sometimes only a telephone call or a WhatsApp message is all you have the access for. So amongst this environment, getting to the level of the best competency and and a safe knowledge level is what the student is thinking. And I'm sure my colleagues are now going to take up as to how the educators are looking at combating these issues and challenges in terms of these times. So, that's from my side, and I'm happy to take further discussions from the student perspective.
Okay, thank you ever so much, Khairunisa. And I think you've highlighted very important points, which are not only relevant to Pakistan, but I think that's what's happening all over the world, wherever we are, because the internet connection, connectivity, and I think it's also the fact that we are not used to of delivering and teaching and being taught in that sort of manner. So I think that adds up to the stressors. Students, many of them are very much tuned into many of these online activities, but they have usually used it for pleasure purposes, for watching videos, or for for the social interaction, or many of the other sort of aspects, not necessarily for learning. And I can see, I mean, obviously nursing students are a bit older and they're adults, but it's like you can have them spend a whole day on games and stuff, and that's not a problem. Learning for half an hour becomes a big issue, and it's a bit too much. So thank you ever so much for highlighting all those issues, which are really important. So now I'm going to talk to look at the educators aspects, because it's not only the students who are affected or finding it challenging to do that. There are many different aspects which has affected educators as well, in terms of delivering the online education and how and delivering it effectively. So Eleanor Horton is going to talk about that. Eleanor is a nurse academic from Queensland, Australia, and she works in the University of Sunshine Coast, and which I always get the name wrong, and she'll be able to explain her role a little bit more. She's got many years of experience of working in the UK, New Zealand, and Australia, and also she's experienced teacher in nursing and midwifery program, and also involved in development programs across disciplines. So Eleanor, over to you. Thank you. You're mute, Eleanor.
No.
Yeah, now.
Now, okay. Yeah. Okay. Thank you everyone for the opportunity to talk today and to share some issues that have become an issue for educators with COVID. I think these issues fall into two categories, and I'll talk about them in terms of being personal issues or professional issues. And I think whether you're a nurse educator in a clinical setting or in an educational institution such as a university, personally, I believe overall we were caught sleeping with COVID. We had Ebola, bird flu, swine flu. We'd shifted to natural disasters and climate change. And suddenly COVID comes along, and it was none of those. It was something completely different, and it very quickly presented us with challenges. Or some may say that we've got lots of new opportunities, but they were unplanned and really unthought of. One of the first ones that comes to mind is curriculum development. We used to talk about curriculum theory, and that was extremely important. When COVID came into our lives, there was no time. Classes had already begun for many educators, and overnight situations changed and discussions had to be had with accreditation bodies about significant changes to be made to programs. Students were already sitting in front of educators, and that was the normal mode of delivery for many courses. And for many educators, that was a comfort zone that they enjoyed. So curriculum development has had some issues. The actual teaching mode, suddenly overnight you had to change what you were doing to teach online. And some people say, oh no, it's a type of blended learning or technology-enabled learning. There are a lot of terms used in the online space. That actually requires a different skill set for your teaching style and for the actual content delivery. And using various platforms such as Zoom, Microsoft Teams, WhatsApp, people didn't actually have time to learn how to teach online. They were busy preparing the content to what they'd already organised. So that brought up lots of issues, and content had to be modified. Topics that you could discuss with students sitting in a classroom, you could gauge how they were engaging with you and maintain eye contact, may not be appropriate online. They may not have enough internet connectivity to use the camera properly, to see you, to see images and diagrams, and you don't get that empathy that you're actually feeling in a classroom. So that's, you might have the content, but that walking with the student through that learning journey is a real challenge. Nissa talked about clinical placements. The use of simulation has helped in many places, developed further resources, but this takes a lot of time. It's not something that develops overnight. We've had lots of video resources that we can use, and simulation resources can be developed, but it takes time. And then there's the issue of the students going on placement. And some places don't want students at the moment. And how are they going to maintain some sense of social distancing and keep students safe? And how are we as the institution going to keep students safe on clinical placement? So we've got a lot of issues that we still need to think about, and, you know, sort of going into the future, how do we address those? How do we get students to get the right amount of clinical practice and clinical placement is a real challenge for educators. I think on a personal level, there wasn't a lot of consideration given to, if you have an office space at home, what is your internet connectivity like? Do you have to increase your internet plan? And in many cases, these were just a given. People worked from home sometimes, but now in lockdown, it was all the time. And for the future, how is that going to work? And did it change the family dynamics working from home? If you have children at home, if you have elderly parents at home, how did you accommodate working from home has presented challenges. Going to work may have provided a degree of self-care for many educators. Universities, institutions, you can go for a walk during a break, you can get out and get some fresh air. And this is really important. And there has been some literature around this. People working from home don't tend to have the degree of self-care that they should have. So that there are issues around fatigue and mental health that need to be addressed. The fears and anxieties of COVID are very real. And the opportunity, you may have gone to the staff room and talked about them in the staff room. You don't have that capacity online, even though at our institution we've tried online coffee breaks and things. It's not the same. It's a different environment. Then we have the operational, financial and strategic issues of the institution that are varied in every institution. They've had to move from overnight crisis management to a new norm. What is the new normal? We don't actually know at the moment. So that is an issue that many institutions will address. But as nurse educators, nurses have always been known to be agile and adaptable. And throughout history, we've always been able to provide appropriate care for patients in a variety of contexts. So that COVID has presented us with the skills. We've already got the skills. We just need to use them in a different way. And post-COVID, we don't know what the future is going to be. We don't know the effects of COVID. It's going to be a new normal, and the challenges that we face now could continue for some time and reinvent them with the next pandemic. If this happens again, will we be better prepared? How will we address it? So I think there are more questions than answers in terms of challenges to educators. The stress levels have risen substantially for the majority of staff. I just think that we need to have platforms like this where we can discuss them, where questions can be raised and we can think about them and see what we actually can come up with to work with the future of whatever the future may be. Thank you, Parveen.
Thank you, Eleanor. Thank you so much. I think you've summarized so well so many issues that educators are facing, and I think the biggest one, all of them working from home and all the different things, it's easier to judge. And in many parts of the world, people may never have had used any online education facilities themselves at all. It may be that there are not everyone likes to be on Facebook or Twitter or use the other social medias, and many nurse educators may not have had used that in their daily life, so they had to adapt to these things. And even those who are quite experienced, because it's a different environment, so you can't possibly just use the 2 hours lectures as you deliver in the classroom on face to face. You can't just turn that around, and in an online environment it takes much more effort and much more skills to write, video editing skills, video making skills. It's easier to talk in front of an audience and in a live session, but if you do 10 minutes video, it takes 10 times double the amount of time it appears. So thank you so much for that. And now I'm going to talk about Hizbullah Khan. I'm going to ask him to present his views. He works in one of the remote areas. Forgive me, Hizbullah, if I'm giving wrong information, and you can correct me with that, but relatively, as compared to other cities and other places, it's one of the remote areas. And the institute, as we all know, we all do not necessarily have the same sort of support or the same sort of resources available to all of us. So he works in a place where the students which they serve and the educators which they serve live in a very different environment. So all these issues, how do they live and breathe? And what happens, what are the strategies which they have used, or what lessons they have learned from students' perspective as well as educators' perspective during this time period? I think my idea for doing this was because it's easier to judge ourselves thinking we are not doing enough, or what we are doing is not good enough. And I think creating this type of opportunities where you get people from all different parts of the world and talking to them makes you realize actually everyone is having the similar sort of problem. And what is it which they have done which we can actually maybe do to help ourselves, or even just to increase our confidence. It would be really useful to learn from Hizbullah just a little bit about himself. He has educated from Al Khan University for generic BSc and completed in 2008 and master's in 2014. He's currently working as an assistant professor at MIT College of Nursing, Mardan, which is part of the Bacha Khan Medical College, Mardan, and he's been there for the last 2 years. Hizbullah, over to you. And correct me if I've said anything wrong about you or the college. Apologies for that.
Thank you very much, madam. Good afternoon and good morning. Basically, I'm sorry for the interruptions. My internet is not working properly. And I'm really grateful to you, Madam Dr. Parveen, that you organized such an informative seminar on this very important topic. And also, it's a great honor for me to be among such eminent and distinguished educators. Firstly, I would like to briefly talk about the challenges in nursing education delivery that we faced in Pakistan during COVID. The first most highlighted challenge to many colleges in Pakistan was the preparedness of nursing educators for online teaching. Like very few were already trained while distinct majority was not knowing how to go about it. And the second biggest challenge was the readiness of students, as they all were a face-to-face classroom teaching. So they were not ready to absorb the online teaching. In my country and most of the colleges, there is no concept of online education. And the COVID-19 brought a big surprise for all of the students to get through the online classes. And the third main challenge was availability of resources. Like now, I am facing the internet problem. So the same problem we faced in remote areas of Pakistan. Many of our students, they are from deprived areas and from the remote areas in Pakistan, and also the teachers are from the same areas. So both of them, the teachers and the students, they face a huge problem in accessing the online content. Now, another big challenge was the clinical placement of the students during COVID. Like, due to serious concerns of learner safety, the students were kept away from clinical area, keeping in mind that if the students were exposed to COVID-19 while in clinical setting, they may be at risk for their health and along with their families. Now we see that the theory component may be somehow delivered in online strategies through various methods, but the practice aspect is a huge problem. And also, we know that nothing can truly replace hands-on clinical experience. We deprive the students from sending them to the clinical areas. And the last challenge that we saw and we faced in this COVID was the course design. Like, the current curriculum is mainly designed for face-to-face teaching in Pakistan and the skill lab training. So very few of the colleges like Aga Khan University or the Shifa International, they might have thought of blending the same curriculum for online and face-to-face. But most of the colleges, they are in the traditional ways of face-to-face teaching. So this was a huge challenge for the educators. Now, the post-COVID nursing education, what it may look like. Honestly speaking, in Pakistan, all of the colleges will press their reset button and they will go to restore all the pre-COVID educational strategies. They will think of the traditional ways what they were doing pre-COVID in the pre-COVID time. But ideally, we need to focus on developing competence in online education, as we learned a lot during COVID-19. There's a dire need of teachers training in online education, the first foremost. And secondly, the training of students in online learning is also very important. The third point is in post-COVID, we should adopt hybrid teaching, a blend of face-to-face and online teaching. We need to organize our courses in such a way that portion of each subject we may deliver through online strategies. And the fourth one, we need to identify and implement new ways of assessment, because it was very difficult. We taught some courses through online strategies, but we were not able to assess them properly. May it be the open book exam or the assignment based exam or any other way. The next one is a virtual simulation. In this COVID time, we were unable to teach our students the simulation part, the practice part. So we need to think of that. We need to work on that, because it may be helpful in such crisis situation if it occurs again. And next, about how the support and engagement, that the organizational support and the team support that can work. I think if I talk about the support within the organization, there's a strong need of coordination among various departments. For example, if you talk about information technology department, which is the main player of the game, they should extend their unconditional support to the teaching section. And this IT department should identify the user-friendly softwares in online teaching and train the educators and facilitate them as and when needed, because most of our teachers, they are graduated from such colleges where there is no concept of this blended or online education. Similarly, the teaching hospitals, for which the nursing college is the main resource for workforce provision, they should constantly coordinate with the nursing college administration. The college may provide workforce to the hospitals in such crisis time in the form of student nurses as a helping hand, but provided that student safety is ensured. Because in the remote areas, the hospitals and the PPE and the availability of those personal protective devices in such crisis time, there's already shortage of such PPEs for the available staff. So how the students' safety will be ensured in that. Apart from this, the team members may support each other in various ways. And this is necessary because the main goal is to overcome obstacles and ensure smooth performance. Every team, is comprised of various competencies. Some members may be quite good in handling information technology. Some may be good in making voiceovers, how to combine how voiceovers with the PowerPoint slides, which is necessary for certain subjects like biostats or any other such subjects. Also, some members are capable of making concise video clips for skill lab based simulations. And some members might have the ability how to organize a course for online teaching. Similarly, there may be members in the team who are efficient in devising effective evaluation methods of what is taught online. So this is the responsibility of, I think, the immediate supervisor or the department head, who should identify the strengths and weakness of his team members and arrange training sessions in order to equip all the team members with the necessary skills so that the targets can be achieved successfully. Thank you very much.
Thank you so much, Hizbullah. And I think you've identified one of the questions which was going on in my mind while you were talking. You've already addressed that in a lot of these places, what is the responsibility of the organizations? Because I know, and I think again, this is a situation which all of us encounter, regardless of which country, which place, which institutions we are based in. It's the availability of resources, and in the context of Pakistan, especially public and as well as majority of the private institutions, people may not have the facilities available by the institutions themselves. They don't necessarily have a Zoom account provided by the organization or the facilities to do the online meetings and stuff. So people have to come up with their own ideas and own ways of supporting that, and using 40 minutes Zoom accounts and then rejoining all the time again. So coming up with all those strategies is something which is really important, and the information technology department, people who could actually help make all that possible. And again, in many institutions, that's not possible. I mean, we work in a university in a very developed place, but even then we have got a lot of support available, but we feel as if we are the one who have to create a lot of the materials ourselves without much support, because it's not only having the support, but it is also being able to articulate what is it that you want them to do. The information technology people, or people who are able to make videos and other stuff, will only do what you have told them to do. So it is our ability to translate that into that information into kind of practical ideas, which is important. So it would be great to hear maybe a practical example that you have used later on once we have completed, once we have listened from all the speakers. So please do think about it, and thank you ever so much for your contribution. So next, we are going to explore what is the importance and what are the ways through which we maintain communication between students and facilitators, lecturers, course leaders who are providing courses, and how do we actually do that? And this is one of the other aspects which is really very, very important. How do you communicate? How frequently do you communicate? When do you provide information? And providing that information in a skillful manner in itself is a very good skill, which not everybody has. It's a very difficult task. And I have got my colleague, Andrea Fox, who is a registered nurse and currently teaches at the University of Sheffield. She leads undergraduate pre-registration adult nursing programs. She's got her hands full with lots of students asking lots of questions all the time. Her background is in renal nursing. She has spent almost 18 years in clinical practice and now delivers renal education. as well as the adult programs at the University of Sheffield. She's really good at giving very clear and concise messages to students, straight to the point, and very, very clear indeed. So we would like to hear how she has learned that technique and what skills, what are the tips that she's going to give to others. Over to you, Andrea. Sorry if I missed something, you can correct me.
No, that's absolutely fine. I hope I can be as clear as what you've just made me out to be. Thank you very much. So as Parveen said there, I also deliver renal education, and I was fortunate enough that I actually deliver online renal education. So my renal courses that I run for qualified nurses are all online, which actually gave me a bit of a head start when it came to lockdown and we had to move everything online. It has also helped my students as well, in that all my cohorts had some experience of having sessions online because of the experience that I'd had with my renal courses. So again, this just helped us a little bit when we all went into lockdown. One of the things that quickly became apparent sort of shortly before and as we went into lockdown was that we're in a really fast changing environment, and students, well, we were finding that we'd say something to students on one day and then possibly the next day or the day after it would have all have changed again. So things were starting to get quite confusing, and so it rapidly became apparent that we needed to have regular updates with all our cohorts of students because different things were happening with different cohorts. So our third year students were a priority at the time because we needed to get them out on placement so that they could actually still qualify this year. There was a really big push from our governing body and from the UK government really that third year students were still able to qualify because we're going to need them as part of the workforce. Our second year students did eventually go out on placement, and again that was quite a challenge, and our first year students were held back. First year students didn't go out onto placement, so as you can imagine, communication with all the different groups was quite a challenge. What we actually then set up were regular meetings with all the students, well, with all the different cohorts, ensuring that we did try and keep them up to date as much as we possibly can. But the one thing I found with students was it was important to be open and honest, and make it clear to them that how we were working on things, that yes, they were asking us various different questions, and if we couldn't answer them, it was being honest about why we can't answer them. Often we were waiting for guidance and information from our local health authorities, from clinical partners, from our governing body, sometimes all three, which made it quite a nightmare. But that honest, open conversation with our students, I think really helped, and did make us feel as if we were working part of a team with our students. So when students were getting in touch and asking questions, they were very mindful that we were working under really difficult conditions, and they were very understanding of that. And that is the one thing I have found before COVID, that students weren't always particularly understanding about how we were working and the things that had to go on behind the scenes, if you like, to make things happen. With COVID, with these open and honest conversations, they suddenly started developing a good understanding of what was actually having to happen behind the scenes. And therefore we're a lot more tolerant. And I feel actually I've got a better relationship with my students now than what I perhaps had before COVID actually occurred. I think communication as well with partners has always been good for us, but again, that's improved as well. So what we have actually started doing was to ensure that our students who were out on placement had the support that they needed. And this actually came from, we had one small group of students who were out on placement when COVID hit and when we went into lockdown, and they continued to the end of their placement. one of the bits of feedback that they gave us was that they actually felt very much sort of isolated and alone, and that we didn't support them particularly well. So we took that on board, and consequently what we are doing now, and I'm actually going to continue with this beyond COVID. So this is one of the positives that have come out from this situation, and that is to have regular joint catch-up meetings that students can come into if they wish. So they are optional, and there's myself, some of the placement team, there are also one or two other lecturers, as well as clinical partners join that as well. So students can ask questions, we can provide information on different things that are going on, and they've actually proved to be really popular. And as I say, we are going to continue with those. The other good thing about doing things online, and again, I think this is one of the things we're going to continue with, is that you can record the sessions. So anybody that can't make it, we record them so they can catch up with it later if they wish. And one of the things that I have had to do a lot of is online tutorials. And once again, this is something that I think we're going to continue with, because supporting students, academic work has still continued. So therefore students needed support with that. And online tutorials have been a great way, particularly for some of those with special learning needs, that we can actually record those sessions, those tutorials, and they can watch them again at a later date. So they've actually said, we prefer this, Andrea, this is actually really good. Sorry, I'm just looking at my notes here. So communication with our students, I think, has improved from all of this. It's in many respects, it has been quite a positive experience. And going forward, there's a lot of things that we've actually done that we're going to be continuing with post-COVID as well. Thank you.
Thank you, Andrea, and that's been really useful. And I think the importance of communication with students and keeping them in light as to what is happening, and sometimes being kind of, being able to share that the difficulties that we are facing. I think it is important because it makes them understand that we are human, we are going through the same pressures as they are, appreciate what actually human life looks like, what it is when you go into the practice. And I think we can't overlook the importance of communication between the team as well as lecturers. Students talk to each, lecturers talk to each other or not, that's a different thing. We talk in teams or not, but students do talk to each other. So if we so if we do not know what we are saying, and if we are not talking or giving the same information, or one person doesn't know what the other person is doing, that can create a lot of problem. So one thing which Andrea has talked about students communication, but she also tries to maintain communication with the staff, with the lecturers, with the facilitators, with clinical partners, whoever is involved in teaching, regular communications with them as well, so that everybody is giving the same information. There are opportunities to ask questions, and people are able to answer that. I think flexibility here is very important to mention, in this context, is that not all the time everybody is able to attend. And that's fine, as long as there are opportunities for people to ask questions, to be available at different places. So we don't expect them to be there in all the session all the time, but as long as they are able to refer to the recorded sessions that we have, ask information later on. So just the clarity of communication and the consistency of communication, which has really helped us in our situation. And I think that's something we need to continue even after the COVID thing. And as I say, we may not be using WhatsApp groups or Facebook groups and other things students are using. So it's important to be consistent and to be able to give that information. So thank you so much. So that brings up to our next presentation, in which we talked about the issues that students are facing. We talked about the issues that facilitators and lecturers and educators have been facing doing and delivering education, communication, and all the rest of the stuff. Let's hear from Mary Louise Blyking. She is based in Netherlands, and I'm going to tell you a little bit about Mary Louise. Mary-Louise has expertise in intensive and critical care nursing, and her research has nursing autonomy and professionalism as its impact as the main focus. She has worked as a critical care nurse practitioner since 2014, and she has supervised various research projects on intensive care nursing. And currently, she's finishing a PhD at Leiden University in the Netherlands, and her thesis looks at nursing professionalization, nursing autonomy, and implementation of the new working methods within nursing. She's a member of various different bodies, and she leads the Sigma, the European chapter of the Sigma, and she'll be able to tell you a little bit more about that. She is involved in quite a lot of the initiatives done by Sigma, especially at the international level. So I thought, looking at what we have all discussed, considering her experience of being involved internationally at European level, at international level with Sigma, having an insight from other people, she'll be able to talk about what post-COVID-19 education looks like. We do know that none of us know that very clearly at the moment. It's all speculation, and it's what do we think it looks like? What is it that we have learned, and what is it that we think we may need to start thinking of doing it better or doing it constantly going in future? Mary-Louise, over to you.
Andrea and Hezbollah also, who have gone before me, which I think everybody has touched in some way in their presentations on what I might be saying in the next couple of minutes. So I'll try and sort of draw it all together. Parveen has mentioned the Sigma word, which is a global organization of nurse academics. And I can see somebody's put a thumb up, so it's not totally unknown. Yes, I'm now probably about 3 years as a regional coordinator, and Parveen has alluded to that voluntary work has obviously enriched quite a lot of the way that I look upon things and the way that I act upon things, as I am not at the moment a nurse educator. So this is my perspective from running the regional platform, shall I say, and several committees. So here we go. I think for the long term for nurse education, I think we've just had a big dry run. I think that there has been virtual technology for the last 5 to 10 years, but neither business nor education nor clinical practice has really actually used the potential. I think we've just been very comfortable going along, and this has been quite a, as I say, an upset, but in some ways it has actually speeded up something that I think should have happened some years back. But I think people were not complacent, but you think going virtually, for example, that's a lot of an undertaking. It might have costs, it might have monetary costs, as I say, it could have healthcare costs, even as my colleague Eleanor alluded to, the self-care policies that might not be, as I say, optimal when using that type of learning. But I think we have now been pushed, and I think we've broken the glass ceiling, and I think we have to learn from the positives that we have, because I think, as Andrea Fox mentioned, there are quite a lot of positives for nurse education in the future, if we can hold on to those pearls, shall I say, at the moment, and try and work and smooth out the pitfalls, because obviously with this dry run that we've had, it's been kind of head over heels and going. So I think to pull the brake at the moment and just to reflect, because I think a strategic policy is very important, and to sit down and I know the term lessons learned, we've had that now from the ICN, Howard Caton and Walter De Caro, to mention 2 colleagues, have been mentioning, about lessons learned in clinical practice from the nurses on the front. but I think also nurse educators need to look at that as well. And every institute, every clinical instelling, every university will have to maybe slightly put the strategic plan that fits their obviously monetary funding, their student intake and whatever. So one size won't fit all. But I think that's very important going forward, that you have everybody, and I'm now talking about implementation, everybody on board, everybody participating and engaging. Because if you don't have everybody in faculty or in clinical practice coming together and owning it as an ownership, then I don't think it will work effectively. And then you will get, as Eleanor was saying, you know, that lack of self-care among the nurse educators, and then you'll have problems maybe with students, you know, who either fall behind or burn out. So I think you'll have to look at, you know, the skill sets that nurse educators have when it comes to virtual programming, because I think we teach, but have we done it effectively? Have we used all the skills that are available? Looking at myself, before I took over as regional coordinator, where I do everything online, it's virtual, because Europe is a massive landmass. So, you know, no, I wasn't ready, and I have learned things, but have still a lot to learn to get, you know, that virtual programming up and working to its absolute, you know, best. A colleague of, I think it was Hezbollah, mentioned hybrid teaching and new ways of accessing. So I think various virtual simulations, and I do know that the School of Nursing at Coimbra, Portugal, have got this Body Interact set up in the last couple of months, where they're teaching their students anatomy and physiology online, and they will be developing this in further. So I think that a lot of preparation work has to now be done, and to look at honing it in so that it doesn't, you know, you're sitting for hours on end behind a screen. And I think that preparatory work makes the fact that we work smarter and not harder when we're online. And what else? I think, yeah, as Andrea said, you know, when you do virtual, you can record and you can send it out later, and people can watch it multiple times. So I think over and all, education has the time at the moment to just assess what has gone well for them and what hasn't, and then to look at it on a, I think, on a regional basis. Looking at the Netherlands, that will be on an institutional basis, because we're all very financially, dependent on funds. So there might not that participation working together as a land thesis might be slightly difficult. But I think thing is, the time that we spend now looking at these various positions will actually make, in the long run, a far more effective policy. And I'm slightly worried that if we don't plan now, that we might revert back to some of the old practices, which, as we know, were good then, but obviously we could do better now with the knowledge that we have gained over these last 4 or 5 months. And I do hope that institutions will realize that and will give the time and the place to do that. In other words, you know, to have those online tutorials, those multidisciplinary, where you have students as well as, you know, have educators as well as faculty, administration together, looking at how to, to hone in the skills, you know, to move forward. So that's my small take on it. Thank you.
Thank you, Mary Louise. Thank you so much for giving your thoughts. And I think one of the important points, which is about the, I'm just going to pick on that one, the interdisciplinary working and working with other professions. So we here at Sheffield have recently merged with other 2 schools. So we are kind of a bigger school now. So we've got speech and language therapists, orthoptics, and colleagues working in other disciplines with us. And we are going through these things that actually you learn that quite a lot of concepts and quite a lot of issues that we are dealing with, other professions are dealing with that as well. So trying to find ways to do the teaching together, trying to find ways to, and I think like whoever, all of you know me, and I think for me is nursing is something which is really important. And I think raising profile of nurses, I think it's more about when we interact with other professionals and professions, it is also that we let them know how good we are, what is it that we do better. And I think interprofessional opportunities and these sorts of activities provide those avenues to us where we are able to interact with other professions, not only to share our knowledge, but also for the betterment of our profession as well, really. So I think that's something which is really a useful point. And also designing it, but then making sure that we are not, we are taking care of students, we are taking care of lecturers, we are taking care of all those people who are involved in all these various activities. So thank you ever so much for that. We are happy to take any questions if people have. I'll just start off with a question which we already have got into the chat box. And if you would like to ask any other questions in terms of any practical example, for instance, or anything else that comes to your mind in relation to each of the talks that we have given, or generally from anyone, please do keep on adding into the chat box. So Shehzad Inayat has asked first question, which is how regulatory bodies like PNC refers to Pakistan Nursing Council, can play its role. As you may know that PNC does not recognize and give credit to an online master's or any other degree. Before COVID pandemic, there was no importance given to virtual learning. Okay, so Shehzad, very interesting question. I think the PNC is probably not the only body which has got problems or is encountering problems with regards to online education or nursing education going different ways. I think all of our respective nursing councils, wherever we are, have been having those issues, and I think all of them have to collectively work with it. With regards to PNC, I think another bigger element is the Higher Education Commission in Pakistan as well. So it's not necessarily only PNC, but it was the Higher Education Commission in Pakistan which didn't used to value online education as such. However, there has been a big push in with that, and hopefully things will change now that people are forced to look into these aspects, even if they wanted to or not. So I know that in the past 4 or 5 months, a lot has happened in different universities in Pakistan through Higher Education Commission. Higher Education Commission in itself has delivered quite a lot of sessions online, believe it or not, for researchers, for educators. They have created their own television channel which has 24 hours broadcast on it for various different things going on. So hopefully it will change eventually. I would like to ask Andrea and Eleanor to say anything what they think from the perspective of their respective nursing councils. And then I think Dr. Rosina is here. So I think she probably would have an idea of what PNC and the Higher Education Commission are doing, or anyone else from Pakistan who has got, so if you just raise your hand, we'll pick you up. Andrea, over to you.
So the NMC does accept a variety of different teaching formats. So it's never been stipulated that we can't use online learning, and so therefore we have. And I think, you know, actually the NMC are very keen that students develop digital literacy skills. And this is one of the reasons why I've always included online sessions. So it's not just about the nursing-y things that they're learning, but also the skills around that. So I always felt that was very important. One thing we do have has been a challenge, and the NMC brought in emergency standards. Our students have to meet 2,300 hours theory and 2,300 hours practice requirements at the end of a 3-year program, so that they can actually register with our governing body. They did put in an emergency standard so that some of those theory hours, particularly our 3rd year students, could actually work them as part of practice hours. So as long as at the end of the 3-year program, they still had got 4,600 hours, more of those could be practice hours than theory hours. So we did have that emergency standard in, and they've also allowed us to bring forward the qualification date for our 3rd-year students as well. So they are actually qualifying round about a month early, some of our students as well. So our governing body has brought in some emergency standards. Some of those are now being stepped back from. Some are still in place as well. So I think we've all learnt from this experience. We've also, our 2nd and 3rd-year students had paid placements. So they were actually part of the workforce to actually help in the support of, it was in the hospitals, so, you know, to support patient care. That is a bit of a double-edged sword, really. We've learnt many things from that, and going forward we certainly won't be doing paid placements again. So, you know, at the time it supported patient care, but no, we won't be doing that again.
Thank you, Andrea. Eleanor, what it is like at your end? Do you need to unmute yourself?
We're very similar, Andrea. I'm pleased we didn't go down to the paid placement scenario. It takes me back to the dark days when, you know, you trained in hospitals for nothing, more or less. Yeah, so like we have online programs in Australia, but I know we have countries in the Pacific area that don't and have had real issues with making that transition. And, you know, the internet and server capacity has been one thing that I think maybe for the future needs to be addressed a little bit more as to, you know, how do we get information to students to learn? Our students, some of them had their programs extended because we just couldn't send them on placement. So their program is going to be extended. I know in some countries they resorted to printing out everything and actually using hard copies, mailing parcels to students so that they had information that they could continue learning, because where they were living, they were so remote, there wasn't reliable internet connection. So yeah, we're quite fortunate though that we do have online programs, but I work at a university which we've always been awarded for 5 stars for face-to-face teaching, even though we've had some blended learning and online courses, but going completely online has presented challenges. And going forward, you know, we'll go back to some ways that we used to have, but I think also in terms of technology, I think, Marie-Louise, the Interact that some universities have developed, especially around the science subjects, the use of simulation and things, if we could get student internet capacity being more reliable, I think that there may be other ways that we can actually teach. But I think it's, yeah.
Yeah, thank you. I would like to ask Karenissa about the perspective about the PNC and what, you know, any new developments before anyone, if there is anyone else who is going to have some comments, we'll take that later. But Karenissa, over to you, please.
Yeah, thank you, Parveen. I wanted to just highlight one part of the conversation that's going on in the chat box as well. That, you know, when we talk about the wasn't accepting online degrees. You know, it owed a lot to the quality of how the courses and how the skills and competencies would be delivered. HEC was not allowing the degrees accepted that were done online. Right time, and it is a good time for us nursing educators to get together with the Pakistanis on our experiences. And right now in this situation, we do have a yes and a go ahead from Higher Education Commission. So starting
Is anyone else having problem listening to it, parents, or was it just my connection?
Yes, I think we've just lost connection with her.
Yeah, I'm back.
Go on then. Again.
I hope that was not PNC or HEC. Okay. Am I audible, Parveen?
Mm-hmm.
All right. So what I was trying to say was that, you know, as educators, if we get together and assure them of the quality and help them tie in indicators and revamp the curriculum in a manner that balances the quality assurance issues of the curriculum itself, the credit framework, how we entail simulation and balance out the must-know clinical hours of the curriculum. I think that should be able to give them that we are ensuring quality, and so there should not be a question in going on in the new normal with this, because things going back to where they started from does not seem possible. It is going to have an impact. The COVID is going to stay for a bit of time and life is going to change. So this is the time that we have the permission from our Higher Education Commission. So Nursing Council, starting from securing funding for the resources for nursing schools, funding for capacity building for the faculty. So if you have credentials and if you talk about quality indicators, and then we get together to transform the curriculum in a way so that the competency and the safety of a graduate's training is assured, I feel that there will be a lot of acceptance now in the new normal for us to continue in this way. And, you know, so let's not miss the boat amid COVID that we have and the permissions that we have to move on.
Okay. Thank you, Harinisa. Thanks a lot. Sarfraz, you've got your hand raised up. Do you want to unmute yourself?
Thank you, Dr. Arvind. Based on the listening and discussion that is going on about the online post-COVID, personally, I think we should not be in rush and we should not be in slow. We should take a balanced approach. We can start by starting at least in the post-COVID, at least 1-2 courses conducted by the trained faculty members through online before moving to the whole curricula online. Otherwise, you know, we can move ahead, but just like the speaker was saying, preparedness by the institution and by the faculty is very important, and even transforming our curricula in view of the online teaching. So my suggestion is only to take balance instead of the rush and slow according to the pace of the international demands and contextual needs of Pakistan. Thank you.
Sorry, thank you, Sarfraz. So next question is from Hizbullah, I think. How to ensure that online teaching or training for faculty member in view of existing phenomena regarding lack of vision by leading persons in organizations?
This is my questions.
Yes, Sarfraz, yes, I know. So Hizbullah, I'll ask Hizbullah to see, I think what you're basically asking is that how do we ensure the faculty members and the lecturers and people who are developing are trained as well. So so let's see what he has to say, and then anyone else can add. So Hizbullah, you need to unmute yourself.
Thank you very much, Madam. First, I would like to say that HEC in Pakistan, Higher Education Commission does not have any problem with the online education, because we have this Alam Iqbal Open University in Pakistan, which is delivering all of its courses in all disciplines completely online, and HEC has not discouraged that. Secondly, if we see the Pakistan.
Okay, we've lost Hezbollah. I think it's not, well, I partly agreed, probably is not HSC solely, it is the nursing leadership who gets involved with HSC in developing, because anything which is developed about nursing education cannot be done without the involvement of the nurse leaders. And as we have already talked about this throughout the session today, it was actually not that the problem, the online education was the problem. I think it was our attitude as faculty members, as facilitators, as those who are as educators, which was the problem. And that was going into the institutional support as well. And that was reflecting into all these practices too. So I think this situation has given us time to reflect on that, and hopefully it will help. HEC does have some speculations about what the courses should look like. So I think this is something that we, people who are working with HEC and PNC can always pick up. But obviously there is much more interest and much more improved interest into the online education. So thank you. Shehzad has asked another question, which is about what are the recommendations based on experiences from this COVID pandemic at individual, organization and policy making levels for developing countries like Pakistan? Good question. Who would like to start? Shehzad, I would like to ask you, what do you think? If you unmute yourself.
Yeah, thank you very much, Dr. Praveen. Can you hear me?
Yes, yeah.
First of all, thank you very much for this wonderful session. I think so this is much needed. In my point of view, approximately a lot of discussion has gone on about the recommendations, as I posted this question earlier on, like, at the organizational level or at the individual level, the nurse educators need to prepare themselves. Like before this COVID-19 pandemic, there were no opportunities for the educators to have a chance to prepare themselves for online education or virtual teaching learning, right? So I think so nurse educators need to pay attention to learn the skills and knowledge to deliver all these for all this virtual learning. And again, at the organizational level, as one of approximately all the speakers said about, like, the organizations need to provide the opportunities and resources in terms of provision of the adequate technology and all other resources that can make this process meaningful and helpful for the students. And in fact, as I asked my earlier questions, like the role of regulatory bodies, in fact, at the policy making level, the regulatory bodies need to think about it, like we should have take this on from this COVID pandemic. Like if in future we face another pandemic like COVID, we should have some plans, and we need to give the opportunity for the online courses. Thank you very much.
Thank you, Shehzad. I think, yeah, so I guess I'll just take the next question because you've summarized it. We've talked about the issues throughout the discussions about that, if that's okay. So a couple of questions about Asma has asked and Tasneem has asked questions about how do we make sure that evaluations are done, online evaluations are done correctly. I think there are ways to evaluate the online learning correctly. Again, there is a lot about, in our experiences, there is a lot about facilitators' anxiety about, and also the ability to design the assessment, which has been a problem, but there are ways through which you can do it. I think problem with a lot of the institutions in Pakistan is that they don't necessarily subscribe to any online environment like Blackboard or anything else like that. So that makes it difficult. Having said that, there is a lot of new technologies are being developed where you could even invigilate the learners, and they're still able to do it. So international organizations like IELTS, OET, they have started doing those sorts of stuff. So there would be quite a lot of learning from that. And there are some aspects which we have also gathered. And I would like to ask Andrea to say something around that. How have we managed here in Sheffield?
Yeah, so we made some massive changes really to our assessment processes with students, very much supported by our faculty. Their attitude was that we needed to reduce the assessment burden both for tutors and for the students. So we were asked to look at how maybe we can merge some assessments. Could we remove some assessments? We may need to rethink some of our assessments, but at the end of the day, we still had to meet the learning objectives of those particular units. So we did merge a couple of assessments for our first year so that they just did one essay rather than two separate ones. And created some scenarios as well, because part of one of the assessments would have been based in practice, and obviously our first year students didn't go out on placement. So we created some scenarios and they looked at health inequalities based on choosing one of those scenarios, and it still continued to meet the learning objectives for that unit. We also, we did actually continue with our exams. Our exams were going to be online anyway, but they'd have done them in an invigilated exam room within the university. So students did them at home. They did become open book exams, but what we also did as well, recognizing that students were at home with families, with young children, and asking your kids to be quiet for an hour or 2 hours while you did an exam was just not going to be feasible. So what we actually did was made them asynchronous, so opened up the exams so they were open from about 1 in the morning till about 11 o'clock at night, so the student could do it at a time that suited them. Some of the exams were also multiple choice exams. So with that, we were then able to randomize the questions and also randomize the answers, so that we didn't have some students doing the exam and then getting in touch with their friends and saying the answer to question 18 is this. So although we weren't able to totally remove opportunities for unfair means, we negated the possibility of it as much as we possibly could. So yeah, there were lots of things that we did with online assessments, some of which actually we are carrying on with into the next semester as well.
And myself and Andrea, because we've always been doing online activities anyway, so it's how you design those activities and how do you embed them going forward. So it may not necessarily be one thing at the end, but how do you actually embed them to make sure? And in addition to exam randomization and all the other aspects which Andrea has mentioned, in my observation, being an external examiner of different universities as well as in our own universities, while educators do think that it may be students may be able to cheat or something, but exam timings and the number of questions which they have to do and the effort is such, and the browser locking strategies even in our own university, we did have use the browser locking strategies where you can control the screen of the student, so which they can't either go to any other browser. But there is another university which uses the screen capture technique, so they know what students are watching into their screen and also what they are doing in the environment. So that is something which is possible. But simplest thing also is that exam requires that much of an effort. So for instance, if one question takes 1 minute to answer, there's not too much time for the students to actually manipulate and do something. They're either going to lose marks by missing the questions or trying to find the answers and doing something online. So whatever examination that I've seen are designed in that way. So it's not really that possible. Open book exams is another example which I've seen at many places, especially with prescribing courses and all the other aspects, where students are able to use the books. They're allowed to use the books, but then obviously they don't know what questions you're going to ask, and it's not easy to look for the answer for a question in an MCQ or other format going through a book, which then brings up an interesting aspect of teachers' ability to design questions effectively and design MCQ questions effectively can be used. That's another thing for some other time. Khairunisa, you have your hand raised, so you have something to say.
Yeah. So with all the examples that were currently shared, we were able to do a lot of these reflective scenarios and picking up the best answer depending on the access and the quality of the internet that our students have. One thing that is also happening around the world, also at AKU, is a little revision of the passing policy. So instead of assigning a letter grade amongst the student, looking at the scenario of an access issues with our student in the context, the university has let
Khairunisa, connection is not letting her speak.
The competition sense in terms of having a pass and fail grade for one semester with connectivity, resources, and the early that yes, we have to have exams to. Am I audible?
You disappeared in between.
Maybe I should put my camera off to see if my voice gets through.
Yeah.
Is this working?
Yeah.
Yeah, so the policy that we've made, the university has made for this semester is that we have to have assessments in order to pass the student, but a minimum 60% passing has to be attained in order to be promoted. So in some scenarios, it may be required that some policies, the progression policies, are revised in a way to accommodate the results of the student or the assessment of the students. So, in line with what you just shared, we've been able to, where students have good access, we've had synchronized exams, where we have open book exams, people are, forced to think and put in their bit of the reflection rather than just selecting the answers that they have. So, a mix of assessment in order for online teaching, for remote teaching, for remote assessments, the faculty has to be prepared and trained in order to, administer the exam that suits the needs of the population that they are catering to, and the kind of resources those students have to be kept in mind.
So thank you ever so much, Khairunisa. And I'm just conscious of the time now. So we are towards the end of the talk, and I would like to finish this off by 12:30 as I've committed. So thank you so much for that. If I'm really sorry if we haven't answered any questions which someone has asked. It's always the case. We try and accommodate as much as we can, but there are more questions than we can answer. So you can drop us an email and I'll be able to have a look and see what answers we can give to your questions. Thank you, everybody. It would be great if you're able to put your cameras on so we can take a picture. And I would be really grateful if someone else could do it, because I'm using a MacBook and I don't know how this functions. So will anybody be able to take a snapshot of the screen? So if we could go into the gallery view, so we can see all of us. And
I can do it if you want,
please, thank you. So there are cameras which are not on. If you don't want to put it on, that's fine. But if you're happy to do that, please put your cameras on. Thank you, everybody. Go on, Andrea.
Okay, Dr. Praveen, thank you so much for those wonderful sessions.
Thank you, everyone. And those who are, I will put the recording on the Facebook and YouTube, so you can, and send the link to everybody so you can share it around. Thank you ever so much for a wonderful session. I hope this was useful. And if you have got any questions, please do write back to us, and hopefully see you soon. Thank you all the presenters. Thank you ever so much for your time on a Saturday. Thank you, Andrea. I know you're busy in clearing and still got time. Thank you, Eleanor. I know it's nighttime at your end. Thank you so much for joining in, and everybody else for all your time and contribution to this. And I hope you found this useful. Thank you. Bye.
Thank you, Parveen.
Bye.
Thank you. Bye. Allah Hafiz.
Thank you, Khairunissan. Thank you, Hizbullah. I didn't forget you. It's just I just.
Thank you, all of you. Thank you, all of you.
Thank you so much. Bye.
Bye.